and welcome back to my channel Psychology with Vijaya, and today we are going to discuss about the MA Clinical Psychology entrance exam syllabus, which is RCI registered, which was before known as MPhil. Since many of the universities have not clearly mentioned their syllabus that would come in entrance exam, this is just a list that I made that can come. This is the compilation of it all. Okay, so let's get started. So the first is your history and foundation of psychology. Now I know it might seem a lot looking at the sheet, but actually most of it you have covered in preparing for the previous exams like CUET, PG or NET, GATE. And even if you haven't, you have already studied this in your bachelor's and in your 11th and 12th class. So first is your history of psychology. It's basically, how psychology evolved through philosophy and physiology, your Greek heritage and your schools of psychology. Then the Indian psychology. Indian psychology is all about how basically Indian psychology came into being, what are the different thoughts of Indian psychology and everything. Then the paradigms, which is epistemology, methodology, positivism, post-positivism. All of these methodologies, all of these paradigms, basically what makes the school of thought of psychology structure. So you should have gone through paradigms as well. Then, and these are just the key movements, which is your how Wundt was influential, then Freud and James. So that is how you have to go through that. Then obviously, since it's an exam for MA Clinical, so psychopathology becomes really important for you. So psychopathology, what is it? What was the history of DSM and ICD? Then there are paradigms of this as well, like the viewpoints of the causes of your disorders, which is your biological, behavioral, sociocultural, everything. So you have to study about that as well. Then comes your disorder. Basically, go through the whole DSM, and everything in this is covered. These are just different categories of disorders that is already mentioned in DSM-5. I have uploaded the PDF in my Telegram group of DSM-5 PR, which is the latest one. If you want that, then join the group and you'll find the PDF there. Then comes your cognitive psychology. Now, cognitive psychology, again, we've been studying it like from bachelor's, and I had psychology from 11. So again, it's really easy. Cognitive psychology is easy. It's basically, what is the introduction of your cognitive psychology. Basically, cognitive psychology has a strong stance from your structuralism. How so? Because structuralism also wanted to study the elements of your consciousness, and that is what cognitive psychology also somewhat wanted to do, and it revolutionized in a way that it now can be studied in AI researches and computers and everything as well. And apart from that, your attention, your bottleneck theories, your top-down and bottom-up theories, all of that will come here. Then perception, your whole Gestalt psychology. Learning and memory, there are 4-5 theories in learning, 6-7 theories in memory. You have to go through that. Then language and thought. The nativist is basically your Noam Chomsky thought, a view of language, right? And many have given the theories in language, so you have to understand that. Apart from that, in language, you also have to understand what is the structure, how is language developed, and there are a few hypotheses in here as well. So go through that. Then comes your problem solving and decision making, basically your heuristics, your thinking part of your cognition, that comes here. Then how cognition is developed, different theorists has given their different viewpoints, so have to cover that. Then how do you actually measure these cognition activities, right? So through EEG, fMRI and everything, so you have to understand their structural and functional value and capacity, whether they can do it 3D, 2D, colored, or just black and white. What is the full form? How is it used? When it is used? Everything. And then metacognition. Metacognition only have 2 theories as of now, and also go through the theory of mind, because people who have autism, their theory of mind is not developed. So there are a few theories like that also, so related with the disorders and learn it. Then obviously research is an important part. Otherwise, how will you be able to understand form criteria and everything? So this is really easy. Research is your basic research, your cohort studies, your observational studies, basically qualitative, quantitative, and mixed studies. You have to understand that. What is research, its definition, the steps, and apart from that, you also have to understand the statistical techniques which we use either in qualitative or quantitative to analyze and understand the data. Then comes your psychometric test and your interventions and counselings. So you have to understand how the assessment is planned. What are the different tests that you have to understand? I have mentioned the name also, which are really important for you to go through. Then test for your diagnostic clarifications as well. For example, your Rorschach, then color form sorting. So um, you have to go through all of these as well. I mean, these are just a list of tests that you should go through before attempting the exam, because there are different types of scales, different types of tests, your rating, inventories, your screening test, your personality test, neuropsychological test. So you should go through all of these and prepare accordingly. And then since we obviously use therapies as well, so you should know special intervention, like when do we use play therapy, art therapy, and such that. Apart from that, you should also know what is guidance, what is counseling, what is the process, what skills should counselor possess. Yeah. Then comes your personality. Personality is nothing, again, testing part you'll already be covering in your assessments, right? So this you would already be covering. In other than that, you have to cover what are the big theories in personality. So go through that, and your emotional intelligence also becomes really important. Then rehab is a very important part of clinical psychology, right? So go through what psychiatric rehabilitation is, how do we practice mental health in community level, what are the preventions like primary, tertiary, and everything, promotions and everything. Yeah. Then the biological basis of behavior. Now, in the biological basis, you might have just gone through the surface level. Here you have to go in depth in biological basis, because they might ask in depth questions as well. So go through the in-depth, like if you're studying a topic, understand that from the biological perspective, not at the surface level that okay, I only have to go through it so that I can understand what the MCQ is saying. Because MCQs, I mean, the previous one, they have said that the CUT PG questions, biological questions, was really organized it a lot, and I don't want you to go blank when biological questions comes in. So go through biological, like this whole unit in depth. Take a book and read that. So yeah, you have to understand your brain, your biological basis of hunger, thirst, sleep, sex, right? So your genetics, because obviously genetics plays a very important role. Then again, there are methods in biology as well, so you have to go through that as well. Then there are ethics and laws in clinical psychology or counseling psychology. You have to go through that as well. Go through the acts that is related to our mental health, our community, our sector. So you have to understand Mental Health Act and National Mental Health Program, PWD Act. Just go through these, because if they ask, you shouldn't be blank. Yeah, and all of these I think you've already might have gone through, but just go through these as well. Then development psychology, again, what are the aging theories, what are the attachment theories, then how people are developed according to different theories, you have to understand that as well. And then social psychology is all about how we act around people, why we do that and everything. So go through that, go through the case studies, because case studies are important in social psychology. And there is also a case study in biopsychology which is related to your personality, so go through those case studies as well. Then advanced psychotherapy techniques, because again, it's an MA exam, so more focused would be on your clinical or therapy, right? So go, and also your ethics and laws, but that doesn't mean that other units are not important. All of them are equally important. It's just that in-depth questions might be asked from these 3-4 units. Okay, your research, your clinical assessments, your psychopathology, your biological basis of behavior, and therapies, counseling. So you have to understand what the new therapies are in the market, which is EFT, DBT, mindfulness techniques, ACT. So understand that, how you assess and manage suicide risk clients, right? So like understand all of these, and then you're good to go. I know right now it may seem like it's a lot, but it is not. Half of it you've already studied, and I can vouch for that. So in either in your classrooms, or you might have attended some workshops, or you already have taken some paid subscription from somewhere. So most of this you have already studied. It's just that you have to brush up on it, and some of it would be new to you, but it's okay. Go through it once, and that you're good to go. But apart from that, there are universities who have given their specific syllabus, like Christ University. So Christ University have their own specific syllabus. So if you don't want to go through that whole, the list that I have given you, just go through the university specific syllabus page, and you can go through that and understand. Okay, they want this, so I would cover all of this. What else? Yeah, if so, NFSU has basically declared that they would be selecting their MA clinical students from CUT PG. So this chance has already gone for those who haven't attempted it. But for those who have, then wait for the results. And if you want me to add any specific universities here, then comment it down in the, like, pin it down in the comment, and I'll add that in the sheet as well. And for those who always look for books, what books to read, I have mentioned authors, I have mentioned title, and what the subject area is. Pulpin is best in psychopathology, so go through that. And yeah, so go through this list, and whichever book you want, just again, send it to my Telegram group and message there that I want, can anybody send me this book, or whatever message you want to send. And if it's there online, I'll search it out and send it to you. Okay, so yeah, that is it. Hopefully you understood what the syllabus is, and what all can come in your exam, where, and apart from that, how you have to study, make a plan of it. And best of luck. Bye.